Hello, everyone. It's April the 23rd, Friday. Regretfully, we've got 13 more deaths that we've got to report, and I'll be doing that with as much honor and respect for these people as I can in just a few minutes. I've got with me today our great General Hoyer, who has led the way with us in every way, and our coronavirus czar, absolutely the great Dr. Marsh. And so they'll be here and talking with you in just a few minutes, but let me do the business at hand and do the respectful thing to these great people that we've lost. Our 2,801st death is a 75-year-old female from Morgan County. Our 2,802nd death is a 57-year-old male from Kanawha County. Our 2,803rd death is a 74-year-old female from Mingo County. Our 2,804th death is a 57-year-old male from Logan County. Our 2,805th death, an 81-year-old female from Nicholas County. Our 2,806th death, a 78-year-old female from Wyoming County. Our 2,807th death, a 72-year-old male from Kanawha County. Our 2,808th death, an 80-year-old female from Boone County. Our 2,809th death, a 40-year-old male from Kanawha County. Our 2,810th death, a 74-year-old female from Berkeley County. Our 2,811th death, a 52-year-old male from Fayette County. Our 2,812th death, an 81-year-old female from Mingo County. And our 2,813th death in West Virginia is a 72-year-old male from Wyoming County. I ask you over and over and over to please don't let these folks just become a number. They don't deserve that. They've been great West Virginians, and I ask you to keep them in your thoughts and prayers. If you don't even know the families, I still ask for your thoughts and prayers in every way. If you know the families, I absolutely hope and pray that you'll reach out and surely let them know that they're not alone. We have 405 new positive cases over the last 24 hours. Our daily percent of positivity or positivity rate is 3.71. That means we've probably tested a good bit. You know, from the standpoint of our cumulative positive, it is at 5.19, and it continues to fall, and we want that to just drop right on down below 5 and just keep on moving down. Our active cases are 7,330. Our recovered cases are 140,550. You see the charts up there. The wider that spread gets on that top chart, the better off we are. We got 248 folks that are hospitalized and 76 in the ICU units. We have 3 counties now in the red. That's Raleigh, Berkeley, and Wetzel counties. Over and over, I tell you just this, that if you happen to be over the age of 65, I always say, but really and truly, if you were under that age, 50 or more, please, if you have any symptoms at all, please go get tested. If you were to happen to be positive and we catch it early enough, we could get you these antibodies, and they'd probably save your life. Now, let me tell you, a very good friend of mine, and I'm sure I'm not going to mention any names or his occupation or whatever like that, but he just has been, he's already had both of his vaccinations, and all of a sudden out of the clear blue sky, healthy as he can be, he's got COVID. Now, I am telling you, this thing is a long ways from being over, and we've got to really stay on our toes. Now, I want to talk to you just a second. I want to talk to you again from my heart, okay? The real truth is just this. This journey's been long, it's been tough, and it's been really long and tough on all of us. I've been surrounded by the greatest team, the very best experts in the land, and through all of us together, we have made decisions along the way, and we've just been blessed by God above because we've made decisions at the right time to really, really make sure that we kept our people as safe and we kept our numbers as good as we could possibly keep them. And we truly became the envy of the globe all across everything we've done. going back to, stopping visitation into nursing homes, to getting them all tested, to getting them all vaccinated, and then leading the nation in the vaccination, effort all across the land. Now, in doing so, we produced the greatest numbers in the history of all time. And everybody was just clamoring, saying, what in the world's going on in West Virginia? I mean, West Virginia is doing this great and this great and this great and everything else. Now, we have hit a wall. And the wall is going to be the exact same wall that's hit all across our land. Now, it's time for West Virginia to move again, is it not? It's time for us to branch out and move again with ingenuity and things that we are capable of doing in West Virginia, while a lot of people sit and just wonder what to do. At the end of the day, we absolutely got an incredible amount of our population vaccinated, and especially our elderly with our Save Our Wisdom efforts. But we got our people vaccinated and got them done quicker than other states around us. Now, so we were faster to get to the point in time when things got tougher. And things are tougher now in West Virginia because there's some level of reluctancy, and the J&J situation that just happened is surely not helping the situation, from the Johnson & Johnson vaccine and them pausing that. But along the way, we've known that this wall, or whatever you want to call it, it was coming. Now, and so we have to pivot again, and we have to move. And earlier today, I talked about this on Wednesday, and earlier today we met, and you will see the rollout of an initiative that is not going on anywhere else. You will see a rollout that is happening in West Virginia immediately that is absolutely going to try to move the needle again, where West Virginia, again, leads the way. You've got a lot of folks that are out there that are reluctant to take the vaccine. You have got an absolute incredible amount of our younger people that just don't understand, the dangers or whatever it may be that they're exposing themselves to if they don't take the vaccine. So with all this, it'll be way more than just a marketing campaign. It will be a campaign to where, and we have already done this, but now we have got to absolutely get the people vaccinated that are willing and wanting to be vaccinated, except it's just an inconvenience. I'd love to get vaccinated. I'd love to get my shot, but, I just don't have time to do it. I don't have time to put it all together and do it. Well, we now in West Virginia are faced with two decisions. One is we can sit back and let that go on and on and on, and absolutely me come to you every day and report death after death after death. Or we can absolutely decide, okay, we're going to solve the inconvenience. We're going to solve the riddle. We're going to come to you, and we're going to continue to plead to everybody that we've got to get vaccinated. Right now, a gigantic challenge to get vaccinated are our children. Our children from age 16 to 35 years of age. So there's absolute challenges everywhere. But again, right now, West Virginia's got to pivot. And West Virginia has really got to do something that is novel and something that's not being done, maybe not necessarily being done hardly anywhere else. But we have got to get all those that are wanting a vaccine, that it is inconvenient, all the children that are out there that absolutely some way need to be educated better, and their parents and loved ones need to be educated better about the dangers of them not taking the vaccine. And then absolutely we need to continue to try to market and explain and penetrate that number of people that are really, really just adamantly saying, I'm not going to take it. Now, with all of that, our goal is beat 588, and that's 588,000, beat 588, ... bad. And that's what we're going to go with, and that's what we're going to absolutely achieve. At the end of the day, whatever absolutely effort that we've got to make to achieve absolutely that goal, which will lead us to all the other things that can happen on a positive note, getting back to our level of normalcy. If we don't achieve the end stretch here, absolutely what will happen, and you can write it down, I'll be in front of you day after day after day after day, reading names, a lot of names. And you know what else? And you got to listen to me on this. These variants are the real deal. These vaccines are incredibly, incredibly successful. Absolutely, if we don't get there, this thing will whiplash on us. And when it does, it'll get really bad again. Now, you got to believe me on this. Absolutely, if it were to get really bad again, we don't want the body bags to be the motivation for us to go do this. Absolutely, we can't let a bunch more West Virginians die that we can prevent it. So we've got to all be in the same situation, all pulling the rope together, all doing everything we have to do. Today we have all the doses that we need, and we continue to get doses in and everything. We absolutely can get everybody taken care of and taken care of immediately. Now, as we move forward here and everything, I ask you over and over and over to just pull the rope with me. And the last thing I would say is just this: in addition to all the stuff that we're going to be doing that we're rolling out right now, we are requesting from the federal government that they reduce for us in some level of our inventory, not the inventories that we have, but the inventories of doses that will be coming in, that they reduce the number of doses in the vial, because we have been so good at assuring, that the very, very minimal, if not zero, of the doses that we have don't go to waste. In doing so, we have situations like hospitals and whatever it may be where we've got discharges and stuff going on, and we have got to have the dosage in smaller vials. And so with that, we have asked for that. We are absolutely going to continue in every way to do our job, but we are now changing and pivoting to a real amped up, a real aggressive program. You'll see the rollout in the days ahead, and it will be absolutely very, very, very soon. So absolutely, we're going to take on, beat 588 and beat it bad. We're going to take that on head on, and we're going to do it. From the standpoint of the J&J vaccine, we've got Pfizer and Moderna over and over and over. I've said this and everything, and so we've got plenty of vaccine for our people. On the vaccine eligibility, it's 16 and above now. Probably a really, really good chance that that age is going to be lowered in the very near future and everything. When that happens, we'll make you abreast of it for sure. I call upon our young people, I call upon our adults, our families and everything to urge our young people to get vaccinated. The general told me earlier today of 38,000 that are age 16 to 18 in the state, we've got 9,000. 9,000. Now come on. We got to do a lot better than that. From the vaccine distribution update, we're at 81.3% first and second round doses. I want to say this too. As we led our nation in all the rollouts that we did, we still lead our nation in how efficiently we have gotten second-round doses to our people. So the percentage of people that we have first and second doses still leads in every way. Now just think about it. Just think about it. What does that really tell you? It tells you without doubt that the job that has been done by these great individuals that are with me right here, and DHHR and all the other folks that have put in all the licks to do the great work that they've done, Dr. Amjad and right on down, in all of our health departments, they have done the job. Now, they have processed people at a speed that nobody else could do. They have absolutely done second-round doses and kept up with the people like nobody else can do. And absolutely now, what we need now is we need the people. We need the people that are saying, well, it's just too inconvenient for me to get there today, or the kids don't want to do it, or there's a lot of people that are sitting out there saying, no, well, I'm not going to take it no matter what. We need the people that have driven the train, and the people that have absolutely operated the systems and absolutely done the efficiencies have done marvelous. Now we got to have more people. Now we got to pivot again, and that's what we'll do. From the standpoint of saving our wisdom population, the number of vaccines administered to the 65 and older population is total of 483,000. That's first and second round doses. We're above 77% of our 65 and older, and that's really wonderful. We're going to be reaching out in a lot of different ways to our manufacturing, our churches, our businesses, where I've been pleading with you, we've all been pleading with you to come on, set us up, where we can come and do your employees, set up where we can do your congregations and everything. We're absolutely getting it done, but we're absolutely needing to do it so much faster. You'll see a little bit different look in the days ahead. Vaccine info lines up. I've told you over and over, you're not going to grow antlers from taking this vaccine. For crying out loud, get with it. From the standpoint of testing and the free testing map, it's all up. We appreciate Frith and Walgreens more than you'll know for the work that they've done. We've got 12 outbreaks in our long-term care facilities. We've got 5 outbreaks in our churches in 4 counties. That's Berkeley, Grant, Greenbrier, and Nicholas counties. Now, I'll tell you that number's down, but I see Greenbrier is an outbreak in one of our counties there. From the standpoint of my own basketball team, my girls' basketball team, just think about this just a second. We may be the only team in the state that last year, we've played in the state tournament, and I don't mean the official state tournament in Charleston. I mean from the standpoint of starting the tournaments. We've played last year. We were at the state tournament, ready to play, and we had to cancel the whole tournament. So my team ended up coming to Charleston. They didn't lose, but they really weren't state champions. This year, we won our first sectional game against Princeton. We ended up with a kid positive. Then that blossomed into another kid. And before you know it, we had 5 other ones. 7 of my team tested positive. I thank God above in every way that I had both the vaccinations, but 7 of my team tested positive. And at that point in time, the only right thing to do was what we did. We basically withdrew ourselves from the tournament, because continuing on would have been useless for one thing, and on top of that, it would have been the wrong thing to do to go off to another place when we could very well end up with a couple of other kids positive. So from our church community and everything, it doesn't really surprise me to see Greenbrier County is ticking up. We've got an issue there, and we need to take care of it. And I'm sure you will, and I congratulate our church community because they've done great. They've done great work. From the standpoint of corrections, we're at 111 inmate cases now and 8 staff. It's 52 at the Southern Regional Jail. That's ticked up. We're at 31 at Salem, 11 at Eastern, and 10 at North Central. Last thing I've got is our guidelines are still in place, and you see them every day there. Our mandatory face coverings are still in place, and I am trying with all in me. For those of you that are out there that are frustrated with the mandatory face covering, trust me, absolutely, I'm going to continue to listen to all my medical experts. I want rid of the mask just as much as you want rid of it. They want rid of it just as much as you want rid of it. They're trying in every way to protect you. And absolutely, that's what I'm trying to do too. Remember to give blood. I think it's an obligation for you to really consider that, especially if you've gotten this dreaded disease. And without naming who and everything, I want you to pray for all those that are out there that are hurting, especially my little buddy that had both vaccinations and now he's got this. So anyway, thank you so much. That's all I've got.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. Just to reinforce some of what the governor has said, we know that the best way for us in West Virginia to be protected, to protect ourselves and to protect each other is to choose to be vaccinated. Many studies are coming out from around the world that demonstrate the effectiveness of these vaccines against all of the variant viruses. In West Virginia, we have seen a slight uptick in the number of, United Kingdom variant viruses, now up to 468, and also 2 additional cases of the Brazilian variant, the P1 variant. And remember, the United Kingdom variant is substantially more infectious. It spreads more easily. It spreads person to person, even from younger people. And the Brazilian variant seems to be more able to avoid our native immune system. And that is even true for people that have previously had COVID-19 and recovered, but not for people that have been fully vaccinated. And as I said last press brief, I think it's stunning to recognize that in Brazil, more than half of their patients in intensive care units are under 30 years old. So this is a disease, and I want the parents out there to listen to this very carefully. This is a disease that has really changed. The COVID variant virus is different than the virus that we were dealing with in 2020. And this virus can infect children, can make children very sick. In the United Kingdom, they've seen a 311 times increase, 311% increase, in the number of children that are hospitalized. In the United States, we now see about 12% of all children with COVID needing to be hospitalized. And 5 U.S. hospitals and hospital systems have set up long-term management clinics for children who have long-term complications of COVID-19. And we know that COVID-19 can lead to heart problems, breathing problems, thinking problems, kidney problems, because COVID-19 affects blood vessels. There's also a recent study out, very importantly for pregnant women to pay attention to, that this is a multinational study that demonstrated that if you did not get vaccinated, risk of death went up by 11 times in pregnant women versus women that were vaccinated, 11 versus 1 in this study. Risk of premature delivery up by 97% in unvaccinated women. Risk of complications of pregnancy up 6 to 8 times. And if people were fully vaccinated, all those risks go back down to what is seen before COVID-19. So COVID vaccines, very safe for pregnant women, very safe for over 16 and over year old people, and soon we believe will be down to 12 years old, as the governor said. And as we look at the strategies that we have to be able to continue to protect our citizens, to protect our residents, to protect our people, our children, our moms, our dads, our grandparents, there's really two strategies that we know work. And one is wear masks and stay distanced and stay away from each other, or the other one is choose to be vaccinated, and after you are fully vaccinated, then you are protected against the variants, you're protected against spreading the virus to other people, and you can be with other people that are also fully vaccinated 2 weeks after and be able to take your masks off and be together. So for me, and I think for our leadership team, certainly I know for the governor, we very much want to protect each one of our residents, each one of our people, and we feel like that is an incredibly great honor to be able to do that. But we need your help, West Virginia, and the way that we get through this is together, and by choosing vaccination and continuing to get to the governor's magic number, we will then be able to be with each other and to be safe and protected against this virus as it continues to change. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just to again highlight a couple of points that the governor made. We have doses available, plenty of doses available to get to West Virginians. What we have tended to see is as it relates to variants and threats as they come across the country, we tend to be about 2 to 4 weeks behind, and we are able to see those things flow. But as it relates to vaccines, we tended to be 2 to 4 weeks ahead of the rest of the nation, particularly in delivery to most vulnerable population. So we are seeing that wall. The governor has identified, and we have identified that, and we are now going to follow the governor's lead and continue to pivot and to hit the right things that we need to hit to get more West Virginians vaccinated. So our mantra in our interagency task force now is beat 588 bad. We know if we can do that, once again, West Virginia is going to shine across the nation and across the world. I'll just give you one quick example of some of the things that we're going to be challenged to do. And last night I spent time with Rick Cavender from Charleston Main Street's program. We're going to partner with all the businesses in downtown Charleston, and we're going to make vaccines available during the day, during business hours, to those employees of those businesses, but also to their customers. So those are the things we've got to do, and we'll step up with the logistics and the support piece to make sure we meet the intent of what the governor's got with this. And again, we've got to beat 588 bad. Thank you.
Thank you, sir. Secretary Bill Crouch from the DHHR and Dr. Aina Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here, and as they say on Monty Python, now for something completely different. President Joe Biden came out here yesterday, Earth Day, with his plan to reduce carbon emissions by as much as 52% by 2030. I've seen at least one study that has said that in order to even make that goal, you would have to see the shutdown of every coal-fired power plant in the United States. I know today the Department of Energy just came out with a report and a series of initiatives. Some of that's going to be led by Brian Anderson, formerly of WVU, now with the Department of Energy, to try to help coal and natural gas communities transition and try to help those communities with the impact of trying to meet those goals. I wanted to get your thoughts, Governor, on what has been announced in the last couple days. Thank you.
Okay, Stephen. You know, I'd be first to say that it's not the news we need or we want in West Virginia. But I want you to stay with me just a second and just think about it. First of all, a lot of times people, when they decide that they want to move in a direction, in order to really move the people, and we do it in the business world, we do it in a lot of places and everything, We throw out the god-awfulest news in the world so people will back up and they will say, well, I mean, let's just say this. If I just said, you know, well, I'm telling you, I'm not doing anything except 3,000. And then all of a sudden later on, we have messengers that come to whomever it may be and say, would you take 1,200? And we settle, and then we get what we want without changing the beat. Now, do I really believe that all of our coal-fired power plants are on the verge of being closed in a very rapid, format or plan? I don't believe it. I don't believe it in any way, because absolutely I know this nation cannot possibly, there's no way on this earth that we can do today without coal and gas. There's no way. There's just no way. So really and truly, though, the news is still bad. And the news is surely just this, that under the format and the guidance that we have now, whether it's smart or not smart, that's surely argumentative. From my standpoint, I absolutely believe with all in me that it is not the course that this nation should take. This nation really, in the last few years, became energy independent. And this nation became strong from the energy standpoint. If we don't watch out, at one time we were absolutely at the perils, of those throughout the Mideast or wherever it was that absolutely controlled, whether it be the Russians or the Mideast or whatever it may be, but really and truly we were exposed in many ways. If we don't watch out, this country will absolutely fall right back into the same situation that we were in years ago. We never ever thought we would be energy independent. We never thought in this country we could be that. Because of our desire for oil, it was unbelievable. It was an appetite unbelievable. So now, by the wonderful grace of God, we found all this natural gas all across this great land. And we tried and we found ways to burn coal cleaner, and absolutely we became energy independent. Well, I truly believe if we don't watch out, and this course is extremely risky. It is extremely, extremely risky. You better pay really close attention to those leaders that are saying just how risky this truly is. You better pay really close attention to the Irans of the world. You better absolutely just listen to even my words. I do not think this is going to be the end of West Virginia. It will hurt. It will hurt. But one thing we've done, and we've done this since I've been here for sure, we have taken on a dramatic new look in West Virginia. We have absolutely moved ourselves into a situation to where we have grown other industries, and we're on our way to doing that right now. Now, you may think that this is just Jim Justice, spewing out things about the personal income tax. But I'm telling you, that would have brought an incredible amount of people to West Virginia, and we're continuing to work that. Absolutely, if we don't watch out in West Virginia, and we sit back and rely wholeheartedly on our natural resources that we've done in the past, and an administration like the Biden administration extinguishes us, we will be in real trouble. We have diversified our economy in ways of medical and high tech and manufacturing and tourism and all the great things that we could do within West Virginia. But the thing that we missed was the opportunity the opportunity to eliminate our personal income tax. It would have driven many, many, many people here. And we have got to consider that, especially at this time with the Biden administration. As we go forward, absolutely, you've got to remember just this, and let this be your security blanket to some degree. We are deriving today in the state of West Virginia the lowest percentage of severance tax from natural gas and coal that we have done in maybe the last 25 years, and yet our economy is thriving. Absolutely, we will not die with the Biden administration. Absolutely, I know, and I will fight for every coal mine and gas job. I will fight with all in me, because I've said many, many, many times, I owe my life to coal, and I absolutely get it in every way. And so, with all in me, I'll continue to fight for every job at every moment that I can. But if the powers to be in a Biden administration that is surrounded by some really odd-thinking folks, if the powers to be strike and try to hurt West Virginia, it will hurt. It will. But at the same time, with our diversification and we're going where we're going in West Virginia, we'll be okay. We'll be okay some way, somehow. So, Stephen, long answer. It's a difficult question. I hope that helped you some.
All right, thanks, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi, Governor. I was struck when you were doing the reading of the information of the people who've passed away in the last 2 days. What kind of data exists, or what is the best guess for of the people who've died, say, in the past 2 weeks, 3 weeks, since the vaccine became prevalent, and a lot of people have gotten 2 doses, especially the high percentage of 65 and older. For Dr. Marsh, if you could address this, and then Governor, if you could also give your thoughts of how many of the people whose information you have read didn't get the vaccine, and what are your thoughts about that? If there's any way to know that, and what kind of message does that send? Thank you.
Well, Kenny, I'm going to go first, and then I'll turn it over to Dr. Marsh. You know, Kenny, we know, without any question, the overwhelming majority of these people have never had the vaccine. The amount of deaths, and Dr. Marsh can back this up, and the amount of deaths that occur from people, within people that have taken the vaccine are so minuscule, it's unbelievable. That's the thing that is just heartbreaking to me. You know, I sit here and I know, you talk about being in a bubble and nobody can hear, and watching people just walk off the cliffs and down they go, one right after another, right after another. And you're screaming at them. You're screaming at them in every way. Don't go there, don't go there, don't go there. And they just keep going. You know, Kenny, it's really tough. You know what is really the toughest, though, is when you're sitting here pleading with people to take a vaccine that you know is as safe could ever possibly be. And yet, there are those that don't. And yet, I sit here and read over and over and over that they've died. We got to change that, don't we, Kenny? We have got to change that. We have got to absolutely lead the way of the nation again. Every single state will absolutely catch up to West Virginia at some time. And by that, I mean just this. You see, West Virginia led the way, way out ahead in the race. And then what happened is we got faster to the point where it got really, really tough. And we hit the wall. We got faster to there by the good job that we've done. But the other states will get there. And then they'll spuddle. We want to be the state that finds the methodology to be able to, when they get there, they'll adopt what we did and they'll move forward too. we got to absolutely solve the riddle. Solve the riddle again. No matter what we got to do, we've got to solve the riddle, or I'm going to sit here every day and read names and be really sad because I hate it. Dr. Marsh, please.
Well, Kenny, we follow and track closely all of the people that die in West Virginia. And we know that out of the 573,336 people that we've fully vaccinated, that less than 150 have been breakthrough. And I just got something from our epidemiology group. We believe about 3 people have died. And if you look at people around the country, 77 million people vaccinated, 5,800 breakthroughs, 74 people that have died. And if you look at the data in nursing home population that was just recently done, nursing home residents and staff, 1,500 people vaccinated, fully vaccinated, 22 people who broke through, 1 person that died. So these vaccines are incredibly effective. In real world settings, 90-95% effective, even with the variant viruses, to prevent severe illness, hospitalization, and death. And in Israel, they basically found all the people who died from the virus who had had any kind of breakthroughs were in that period, in the 14-day period after the second dose where they weren't fully immunologically capable or competent. So these vaccines are safe and effective. As the governor said, that's the reason why we are so committed to trying to help each West Virginian choose to be vaccinated so that they can protect themselves, they can protect each other, but also so that we can continue to see our state thrive, our children, live long, good lives, and our elders, be able to survive something that without the vaccines they would not.
Dr. Marsh, I want you to say it one more time. You said in West Virginia, as best you could trace and let me give you the exact number, but we have. Let me just hold with me just 1 second. All right. In West Virginia, we have vaccinated 543,654 West Virginians with both shots. And how many did you say has died?
3.
Now think about it, West Virginia. There's 2,813 people that I've read that have passed away in West Virginia from COVID. 3 of them have been people that have had both shots. Now, how many did you say in the nation? Tell them the nation one more time and come back to Dr. Marsh.
So 77 million total vaccines at the time it was reported, and 5,800 broke through, and 74 died.
And how many into nursing homes?
1,500, this was a study of 1,500 residents and staff at the nursing home who were vaccinated, 22 broke through, and 1 died.
Now let me tell you again, West Virginia, this man is so smart that I can't even hold a candle to him. Our coronavirus star, Dr. Marsh, is absolutely a superstar beyond belief. Now, West Virginia, do you really, really, really want to be in the nursing home study, the 1 out of 1,500? Of course you don't want to be that, but how can you have better odds in the world than that? Or 74 out of 77 million people in the country, or in West Virginia, 3 out of 543,000. How can you possibly possibly walk away from this lifesaver that is absolutely available to you? And from the kids' standpoint, do you realize with your children, do you realize that these kids, we know, and I am only reporting to you what Dr. Marsh and our experts are saying, but we know there are profound side effects from getting COVID. And we know that if you get vaccinated, your chances of getting COVID go down unbelievably. Do you really want to take that chance with your kids? I mean, do you really want to do that? You know, we know that in Brazil, by Dr. Marsh, our coronavirus czar, that half of those in the ICU units today are kids. Do you really want to go through this, West Virginia? Absolutely. Now, come on. We got to figure this out. Okay.
All right, thanks, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, could you clarify what you said about our request to the federal government? So we're not requesting an overall reduction in our vaccine supply. We're asking for vials with less doses in them. Is that correct?
Well, Charles, to be 1,000% transparent and everything, it was suggested that we have got 180,000 vaccines in inventory right now. And we're embarking on a brand new campaign, Beat 588 Bad. And we're embarking on that campaign, and really and truly, this started, with my little sign on Wednesday. I called our experts to me. They came this morning. We met. We're now aggressively going to pivot and go in a different direction. Charles, to be 100% transparent, it was thought that with this number of vaccines in-house, that maybe what we should do is back down our order, back it down substantially on the number that we were requesting, because we don't have the arms right now. It was absolutely, but I have said, we don't need to do that. We need to keep moving, and so that we can absolutely get out and go to our smaller communities, and absolutely with the smaller vials, we'll be able, and that's a different component, but if we have the smaller vials, we'll be able to do a more efficient job in minimizing waste. Now, you'll never be able to eliminate waste, but to minimize waste in every way, we'll do a more efficient job at our hospitals, and we'll be able to get to our smaller communities, whether it be in a suburban, going up hoo-hoo-holla and trying to vaccinate people. But absolutely, we need the smaller vials, because once we open them up, they only last for a few hours. And so we need that help there too. Or we're going to end up wasting some shots and everything. But at the same time, this day and time, when you have that level of abundance, maybe in order to be able to get the job done, we may have to waste a few. And if we do, so be it.
All right, thanks, Charles. Next to June Leffler with West Virginia Public Broadcasting.
Hi, Governor and panel. I've got two questions. So as far as this Beat 588, I would love just some more clarification on this from some sort of marketing or campaign perspective. So, earlier in the week we heard 70%, that now we're hearing this, 40% is the number that we want to reduce of people that don't want to get vaccinated. And now this 588. I'm just wondering if these are like too many numbers for people to just jive with, and if there's one number they should be focusing on. So just from that standpoint of just what do people really need to know? Why are you saying 588? Why this number specifically? And also, I'm wondering just a little bit more about what specifically you're hoping to do. General Hoyer had a really good example of downtown businesses in Charleston and getting those employees vaccinated as well as those customers. But can you mention anything else specific? Thank you.
Okay, June, before we come to your questions and everything, and I'll do those, but I want to go back to General Hoyer about the previous questions and everything. General, maybe you could touch on that.
Yes, Governor. So, Charles, back to your point on the ask for the smaller number of doses per vial. Part of what the governor's intent is there is we have cases going forward when we've hit this hesitancy point where, for example, pediatricians may have 1 or 2 patients come into the office who need the vaccine and want the vaccine, but when you open up what is now a 6-dose vial of Pfizer, you have 6 hours to use that total number of doses. So what we're asking the federal government to help us with is to allow us to get more to the population we need to get, but to put it in a context that allows us to minimize the waste in doses that we have under those circumstances.
Okay, back to me. Okay, June, and I really appreciate your question and everything. I'm going to do this, and you wouldn't believe it, but in making notes as we go forward and everything, I put beat 588 ... bad, and I put right above it, you know, before we get done, explain the math. And so I'm going to do that. I'm going to do that, but our focus right now, with all the numbers that are floating around, it should change again to this number, and that is the 588 number. Now, how we came to that number was really and truly Kenny Bass's question on Wednesday, with 40% of the folks that are in the state of West Virginia that are supposedly at least thinking about the possibility of refusing the vaccination. Now, there are eligible people that are 16 years of age and older. 16 and older, the eligible population in West Virginia that can take the vaccine today is 1,470,000 people. 40% of that is 588,000. Now, we know if we can penetrate that 588,000, and that absolutely is a population that is a significant amount are our kids, our younger people. A very significant amount of that number are younger people. There is a significant amount of that number of 588 that are people that just would take the vaccine, but it's just not convenient. And so we're going to make it super convenient. And then there's some that are really probably pretty stubborn and maybe fearful or whatever it may be, that we need to relax those fears, and we need to educate a little bit better, communicate a little bit better, to just tell them just what Dr. Marsh said just a minute ago. Of 543,000 people in the state of West Virginia, there's been three people die that have had both the shots. 3. You know, now, your chances of contacting this dreaded disease and becoming one of these that I read every single day that I'm here, you know, your chances of dying like this are, who knows, 10,000 times, whatever the times, 100,000 times, maybe 1,000,000 times, absolutely better to take the shots than to expose yourself and just hope and pray. And it could even be bigger than that if really and truly these variants, you know, you end up with one of the variants. So that's the number. The number today is 588,000. That's the number we want to beat. Absolutely, how we're going to go about doing this is how West Virginia has pivoted. You see, we got to that resistant number faster than the other states. We all knew that. And the other states will get to that number. Now, what we want to do is come up with methodologies and everything to where we'll be able to assist the other states when they get to that number that they don't pause. Now, so how? How are we going to do it? You know, we're absolutely going to give the details to our communities and our businesses immediately. I've given all of our folks 24 hours from right now, 24 hours from now, to give me all the wish list of any and everything that they think we should do to be able to get this done. And once I get that, I'll go down the wish list because I really think that I've got a good sense for what will work and what won't work. Now, what that'll be is it will be that we'll try to be at every fair and festival. We'll try to be at every blue and gold game. We'll try to be absolutely maybe on the Walmart parking lots, or maybe we will have vehicles that will be dispersed and we'll be going up, you know, hoo-hoo hollow, like I've said. But absolutely, whatever it takes, we got to beat that number. The reason, June, we got to beat that number is because when we start really chipping into that number and we beat that number, we'll be able, absolutely without any question, to get rid of masks, to absolutely have our lives back to normalcy, to be able to be having picnics and loving all of our community, whether we live with them or not. We will absolutely defeat this terrible killer. But June, if we don't get to this number, you can mark it down. I'm going to be here in front of you for a long, long, long time. And I'm just going to be adding up the body bags. Adding up the body bags. Now, we got to get to this number. And we got to cut into this number. And so that's what it's all about, June.
All right, thank you, June. Next to Mark Cram with WDVM.
Good morning, Governor. Good morning to everyone. Early on in the vaccine distribution, we heard from a lot of local residents here who were expressing concerns about disparity in the distribution. Now, as I look at the vaccine summary map, and I wasn't really able to analyze all 55 counties, but unfortunately, it looks like a number of my fellow residents in the Eastern Panhandle are not stepping up, that we're among the lowest in the state. How do we change that? I'm assuming it does not have anything to do with the distribution itself, that vaccine is available in the Eastern Panhandle. How do we encourage them to step up, EP residents? Thank you.
Well, Mark, I just touched just 1 second on it, and then I'm going to pass to General Hoyer, but that's the challenge. And I think the challenge has got to be in lots of different ways. We've got to come at this from convenience. We've got to come at this with real data that tells of the side effects of our children. And we got to come at this from the standpoint of promotion and marketing and on and on. But General, you can go from there.
Yes, sir, Governor. So, Mark, you're absolutely right. When we saw concerns based on our data about the number of doses, we pushed, based on the governor's direction, significant number of doses to the Eastern Panhandle, set up large events, particularly with the assistance of all the entities there, but we did not have people schedule and show up for vaccines. We got to the point where local level basically asked us to turn off doses and told us they could not use any additional doses. Going back again, that demonstrates the governor's point. We've got to pivot and we've got to change our strategy, because we have plenty and we have the logistics to deliver, but we're not getting them. So this past week, we had a number of our counties tell us that they could not take additional first doses.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi. We're talking now about getting the 40% of the potential holdouts vaccinated. Last week we use the number 70% a lot in a different context. And I recall from last fall that we talked about herd immunity and getting 70 to 75% of the population vaccinated to achieve that. We know that state borders are kind of porous legal fictions. And so when we're thinking about the whole concept of unmasking, and I don't care about dates, but just the concept, I would think we have to have some kind of multi-state or regional or national approach to it. Can you talk about how that might factor into your thinking? Thanks.
I think, you know, I almost mentioned one thing, but you know, there was mention in our discussions and meeting earlier this morning and everything, you know, that we have our campgrounds all across the state. And we've got about 20% of the folks in the campgrounds that may not necessarily be West Virginians. You know, if they're here in West Virginia and everything, I don't think any of the experts, you know, that were around me did anything except recommend that if they want to get vaccinated, we need to vaccinate them. And so, you know, Mark, there's going to have to be some level of concerted effort along those lines. And but you know, I think Dr. Marsh and General Hoyer both please weigh in on that if you choose to.
I'll start. I mean, I think that, you know, what we are really focusing on now, David, as the governor has pointed out, is that West Virginia has been a leader in this response to COVID-19 for the entire duration of the pandemic, whether it was from first to test all of our nursing home residents to put first and second doses in all of our nursing home residents, or to target our elders, which has resulted in substantial gain of life and reduction in death rates on a weekly basis, that this is the new opportunity for us to lead. And I think as we go forward, we will be examining a number of different approaches that will both, you know, leverage any of the best approaches that we find around the country, but importantly, that will really be directed at leading this next approach for the COVID pandemic, because as the governor said and as General Hoyer said, that we have been ahead of many states and the country to get first vaccines in arms. And so we are starting to see this hesitancy coming up into a group of people that have not chosen to become vaccinated for perhaps a variety of reasons. And we are committed to trying many, many different creative strategies to make that happen. Because as we talked about earlier in the press brief, that we know from our data in West Virginia, our data in this country, and our data around the world, that these vaccines are truly the only real solution for the pandemic that we're in order to save lives and reduce hospital admissions, protect our children, protect their health for the long term. And if we aren't successful in having our citizens, our residents, our people vaccinated, then we have missed a tremendous opportunity for each citizen, each resident of West Virginia, but also to help lead the country. Because as West Virginia has gone, so has the country gone. And so the governor will be the leader. He understands our people the best. He understands how to reach our people. But we will be supporting with a number of very creative ideas that we will put to test. And we will not be discouraged if some work and some don't. We have plenty of energy to attack this, to approach this in a way where we can really feel at the end of this pandemic, at the end of our careers, and perhaps even at the end of our lives, that we gave all that we could to try to save every life of every resident of our state.
I just highlight a couple other points, and I'll use a military analogy and a sports analogy since I'm the general and the governor's a coach. So, number one, the enemy has a vote, and the enemy is the virus, and the virus is changing, and we got to be agile and flexible to deal with the changing enemy. Number two, from the sports side of things, and governor would tell you, you keep running the same play as long as it's working. When the play doesn't work anymore, you got to adjust and go to another play. And we are ahead of the nation in seeing that happen with vaccine hesitancy. So now we've got to make an adjustment and move forward. The enemy's going to give us different things. We got to be flexible and agile. We got to run some new plays. So, and some of the things that we do going forward may work and some of them may not, but this is an ever-changing environment and there's no manual or playbook to follow, and we're going to keep pressing and keep hitting this, like the governor says, until we get to where we need to be.
All right, thank you, David. Next to Mark Curtis with Nexstar Media.
Good afternoon. Good afternoon, Governor, cabinet members, and fellow reporters. I'm going to read an email from a viewer because it may be a symptom of a larger problem, especially in our high schools. And I would like the governor and maybe the doctors to address this individual case. I realize it's actually up to the local principal and superintendent. But I'd like you to address the individual case, but I have a suggestion at the end of this more global question. So here I go. This is from a viewer in the Northern Panhandle. I have a daughter that has just been quarantined from school 3 days before the junior-senior prom. Of course, that's a huge deal for the kids. My question is, she has had both of her vaccination shots and is 5 days away from the 2 weeks to be completely vaccinated after her second shot. It will be 6 days since she was supposedly around a positive case at a school classroom for one period of the school day. If she would test negative, would she be able to go to the prom? That's the individual question. What I'm wondering here is, shouldn't the principal and the local school and health director, superintendent have some degree of flexibility? This sounds like a case where this girl's okay, but she's being barred from going to the prom. Or on the other hand, is it really a danger? And how do we address the danger of one specific case or a few cases like you had, or 7 cases as the governor had on his basketball team? I mean, that's obvious what to do in that situation. But I'm wondering about the flexibility. And to that end, my suggestion, have you talked to Superintendent Birch and Chancellor Tucker? Shouldn't we be mandating vaccination clinics at every public high school in the state and at every public college and university? I realize you can't mandate the 16 to 35-year-olds to get the shots, but if you take the shots to them, you're going to get a lot more fish caught in your net.
Okay, Mark, let me try to answer this for this kid, because I sympathize with her and her family in every way, and I really do. I go back to my kids on the basketball team. You just think about this. In the last 2 years, they have not lost a game in the state tournament, and they've been eliminated both years. They haven't lost a game, and they've been eliminated both times. So it's tough. I mean, it's just plain tough on kids, period. That's all there is to it. It's tough on families. Without any question, and I'm going to have Dr. Marsh or Dr. Amjad, maybe Dr. Amjad could come in and follow up on this. But without any question, we have left this, and we have left to the local superintendents, to the local health departments, for them to do the contact tracing and for them to give us the guidelines on what that they want us to do and that they want to be done. So, Dr. Amjad, before we go any further, weigh in just a second on that, please.
Yes, Governor. So, Mark, I was trying to write down what you were saying about the girl, but basically, the governor is right. When it comes down to what's going on at the local level, the local school board, the local superintendent, and the local health officer does make those recommendations. But to go back a little bit, the girl you're mentioning, we don't consider full vaccination complete until you're 2 weeks or 14 days after the full vaccination schedule. So I think you mentioned she's 5 days away from the full 2 weeks. So even though that doesn't sound like much. We won't consider that, and that's a CDC recommendation that she's fully vaccinated. So not knowing the entire history behind that, she's still not considered fully vaccinated. So whatever recommendation the local health officer or health department, as well as the school, has given to the child and her family, that's what will hold steady for that situation. We have instances where, of course, games, proms, other things, sometimes they do adjust if there's other issues. There's always something that can be considered in those circumstances. But from what information you gave briefly on here, that's what is considered the case. But thanks.
And come back to me again, just 1 second. Mark, one last thing. I mean, and this is just how severe, the local health department in my situation with my basketball team, when we had our first positive, we had a positive with a kid that did not even play in the game. The game was on a Tuesday night. We played Princeton. She didn't play in the game. She's a freshman. She did not play in the game. She sat on the bench with a mask on the entire time. On Wednesday, she wasn't feeling very well, and on Thursday morning, we got a test. She'd gotten tested, and she tested positive. On Thursday, the very day that we had one person that didn't play in the game and wear a mask, our local health department quarantined my whole team. We had a game that night with Woodrow Wilson. They quarantined my whole team. At the end of the day, they were probably right. It was really, really tough. But at the end of the day, where we are today with 7 positives, it worked out that they were probably right. So, Mark, it's a tough thing. It's a tough call. It's a really tough call. I think we've got to rely on the locals to make the calls. Now, as far as being in the schools, I just want to touch on that just 1 second too. As far as making it mandatory and everything and all that kind of stuff, I don't know if you can do that. From the standpoint of our parents have got to listen and hear what's really going on. Our medical experts are telling our parents, if these kids get COVID, there are side effects that you don't want lingering with your kid as a potential positive as they go forward. I have 7 kids, 6 kids that have tested positive and 1 other one quarantined from the standpoint she was with one of those kids, riding in a car. But nevertheless, I promise you that we don't want kids with COVID, even with no symptoms. They transmit like crazy. They absolutely are taking this disease to these people right here that I read every day, and they're walking away, even if they hope and pray they don't get sick. They're walking away with potential side effects that can be really not very good. Now, we need our parents to step up. We're in the schools. We have been in the schools. But literally, we're basically shoved over in a corner and said, well, here's the flu vaccine and here's the COVID vaccine. And I don't mean the schools are shoving us over in the corner. We're moving over in the corner ourselves and saying, hey, Susie or Billy, do you want to take this vaccine? Well, kids, they think they're invincible. And nobody wants to get a shot. And so everybody says, nope, I don't want to do it. So we've got 9 out of 38,000. 9,000 out of 38,000. That's not going to work. It's not going to work. And so that's that story, Mark.
All right, thanks, Mark. Governor, I'll turn it back to you.
Oh, my. I think we've been through everything, that I made my notes on, in the briefing. The only other thing I would add is, and I'm going to tell our great general and our great doctor and all those that, are with us here and everything, that we got to get this. Well, I know we've got these numbers, and and we look at them all the time, but we probably need to have in front of us and really review each county's numbers. Each county's, men, women, children, the number that have taken, out of the population, the number that have taken the vaccine, the results from the standpoint, we know that 3 out of 543,000 that we've lost that have taken both the vaccines. Not necessarily that, but what we need to know is just who's taken, the number of COVID cases that we've had from people that have taken the vaccine. I think we know that number too. It's very, very, very small, but we need to know that are there counties out there where we can put and concentrate more effort into than other certain counties and everything, because the better, the more we know, the better we'll be. But that's all I got, and these great people, they've got 24 hours to come with me. I've got a bunch of ideas myself, but I don't need to share all my ideas. What I need to do is get the experts to give me their ideas, and then we'll put it together, and off we'll go again. West Virginia leading the way, and that's what we should do. You know how I've said it over and over. We're the best of the best. That's all there is to it. Not meaning that we're, these experts and myself are the best of the best. We're the best of the best because we're West Virginians. All of us are the best of the best. I've said it over and over. We got a raw deal for decades and decades and decades about what people on the outside thought about you, but now they think you're the diamond in the rough they missed, and we want to keep them thinking just that. So let's just keep knocking it out of the park, West Virginia. Thank you so much. We're going to get this done. We're going to beat 588. We're going to beat it bad. Thank y'all.